Welcome.
Thank you very much, Jeff.
All right, so why do we even care about cholesterol to start with?
Well, just as Dr. Jones was speaking about earlier, we worry about hardening of the arteries, which includes the carotid arteries, the arteries in the neck, as well as the arteries in our heart, which leads to heart attacks and strokes.
You also have arteries in your legs that hurt when you walk.
That's true. You even have arteries that supply blood to the kidneys, which if they become narrowed or constricted, what will happen is that will affect the kidney function, and the kidneys are there to filter the impurities out of the body.
All right, so if you're going to look at cholesterol, it's a blood test, and then you've got types of cholesterol?
That's correct. When we do the cholesterol blood test, we always do that fasting, which means no food after midnight for a period of about 8 or 10 hours. You can have all the water that you want. And the cholesterol that we look at the total cholesterol, we look at the HDL cholesterol, which is the good or the beneficial cholesterol, as well as the LDL or bad cholesterol. We tend to think of that as the sticky cholesterol, the cholesterol that sticks to the walls of the arteries, that builds up that thick plaque that leads to the eventual narrowing of those arteries.
When you get a number, is there a certain number you can say, well, this is bad or this is good, or does it involve a lot of risk factors that you have to look at?
Well, when we interpret the values, we look at the entire patient. We look at the patient's sex, we look at the patient's family history, whether or not there is a past history of heart attacks or strokes in the family. We look to see whether or not they're smokers or if they have hypertension. Those are some of the individual things that go in to determine what we're going to do with the cholesterol. Now, we ideally think of total cholesterol. We like it to be less than 200, though when the total cholesterol value runs between 200 240, we typically ask our patients to improve the diet. Less red meats, less dairy products to help to get that total cholesterol level down.
So once you know kind of where your goal is by seeing your doctor, you mentioned diet and exercise, but are there some other things? You see commercials. Do Cheerios really lower your cholesterol?
Well, Cheerios do lower the cholesterol because of the fiber that's in the cholesterol, or excuse me, the fiber that's in the Cheerio. We know that if we follow a high fiber diet, whole grains through our cereals, through our breads, fruits, vegetables, that increases the fiber. That will in of itself help to lower the cholesterol to a certain extent. Then there are other times that we need to add medication if we deem that the cholesterol level is at such a elevation that would cause problems with our patients in the future, not just tomorrow or today, but 15 years, 10 years, 20 years down the road.
So the big cholesterol medicines are statin. Are they a good thing?
Well, statin medications are good. They will lower the total cholesterol. They will lower the bad cholesterol as well as raise the good cholesterol. But like any other medication that we use, there are risks and there are benefits and there are side effects to these medications. So we have to use them with some degree of confidence, and we need to use them in the right patient.
And if you haven't had your cholesterol checked, do you start when you're 10, 15, 20, or does it really depend on your history?
Well, a lot of that depends upon the history of our patients. We certainly like to get an idea by the time we're in our 20s to determine whether or not we are tending towards a high cholesterol. It's certainly a lot easier to correct a problem than it is to fix a problem that's been going on for 20, 30 years.
Right. That's great information. If you haven't had your cholesterol checked, get it done, get it treated if you need to. We'll be right back.